When I shook the associate's hand, my whole body trembled. I knew something was wrong.
When I left Ted at the ER, the nurse pulled me aside and told me she was testing Ted for the coronavirus.
He was really about as sick as any patient could be. I wasn't at all confident he was going to survive.
My name is Ted Roberts, and I was Loyola Medicine's first COVID-19 patient. The symptoms started on the night of March 3rd. That day I'd flown out to Portland, Maine. I met an associate for dinner. That night I went home and I started feeling sick.
I talked to him and he told me he wasn't feeling well. Following night, he texted me, really sick, took a hot shower, went to bed, which was, don't bother calling me, I'm really sick. And I knew that wasn't the norm, so I knew Ted was quite sick at the time.
And the associate's hand I shook came down with mild case of coronavirus. One of the clients we were working with came down with a very serious case of COVID.
Then he traveled home. He was out of town and sick for quite a few days. When he got home, within a few days, Ted was running a fever of 104.3. It was on a Wednesday morning, and I called his primary care physician at Loyola, Dr. Hall, spoke to his nurse, and she said, "You need to get him to the ER immediately." And I knew just by the tone she meant immediately. Ted has been treated at Loyola for 20 years. There was no way I was going to take him anywhere else. He's always had excellent care there. So we drove to Maywood, and he ended up in the ER, and from there, it was scary times.
When Mr. Roberts was admitted to the hospital, he was, I think, our first patient admitted to the intensive care unit. And overnight, one of my colleagues, Dr. Shruti Patel, single-handedly spent really her entire night in his room resuscitating him and getting him stabilized. Really single-handedly was responsible for getting him through that night. He was in shock, needing medications to support his blood pressure. He was in respiratory failure, needing the ventilator. And the ventilator turned on, I would say, high to support him.
I was at Ted's bedside for the first 4 days. Being the first positive diagnosis at Loyola for COVID, the city hadn't changed yet. And by day 5, everything changed. I called to say I was coming down to see him, and the nurse said the hospital shut down to all visitors. After I couldn't go to see Ted, I communicated and found out his updates, talking to doctors and nursing staff. I spoke every day to Dr. Simpson, and then once or twice a day, besides Dr. Simpson's phone call, I would speak to the nursing staff or the nurse who was treating Ted. They were excellent at keeping communication open to me and let me feel free to call when I just felt I needed an update.
Our role is kind of, it's modified itself. When he was there, he was intubated and sedated, so I would come by and say a prayer outside his room, talk to the nurse. I know some of the other chaplains may have contacted his wife. I think our role is more adapted to become a connector of people, a link between the patient and the family member. And what we do is offer a chance for the person who's in the hospital to reconnect with their family members.
I was in a coma for 10 days.
Some of the parameters started to improve. Specifically, I think related to his ventilator management, needing a little less oxygen, a little less support pressure-wise from the ventilator.
And the first thing I remember, I was so awake, it was like I had a pot of coffee. And Dr. Simpson said to me,
I don't want to get too carried away with these improvements, because sometimes things get a little bit better and things get a little bit worse, but you know, this is good news that we're starting to turn the corner.
Just interesting to wake up, I even knew his name.
You know, as Mr. Roberts improved, eventually he did get transferred out of the intensive care unit to, we'll say, the regular ward, into the hands of our colleagues in hospitalist medicine who took care of all the ward patients with COVID. I remember being personally satisfied, gratified. You know, the nurses were like really overjoyed that he had made it through this. You know, I remember talking with Mrs. Roberts, and of course, she was extremely happy about that as well.
Now I feel unbelievable.
Ted walks 50 miles a week.
I walk 7 miles every day.
I think he's a little obsessed with it, but He's proactive on his health, so it's a good thing.
I feel like I'm 40 and I feel absolutely great. Many doctors, inside and outside of Loyola, many people have told me if I wasn't under the care of Dr. Simpson, I probably would not have made it.
The main thing about Ted's course was that he made it, and he made it early on as our first patient, which I think was really important for all of us as we cared for other patients in the future. Knowing that he made it, coming in as sick as any patient possibly could be, gave us hope that others would make it as well.
There were a lot of people, Dr. Boyle in the emergency room, and the whole staff in the emergency room and all the other doctors, Dr. Patel, all the nurses, all the dietitians, physical therapists, they're all the ones that really pushed me through this.
And then we had tons of interaction with colleagues from other departments. Our hematologists were critical with reviewing information in real time and making recommendations for how we should manage that aspect of the disease. Our nephrologist for the renal failure, the endocrinologist, I mentioned that. Really every discipline was evolved. The real heroes, if there are any, in his management are the nurses who cared for him. Because while I would go in for brief periods of time each day, the bedside nurse would be with them for hours every day. Across the hospital, our nurses deserve so much credit. I just can't overstate that. But the nurses in 4 ICU who took care of him were really remarkable.
I want to thank all of them. The people that cleaned the room that Ted was in. When I was there at the beginning in ICU, they would go in and clean that room, and you knew they were putting their life on the line. Just the woman cleaning it, all the way to the doctors and the nurses. But you can't forget the people who are doing those other chores that have to be done and are still just as important. They were keeping the environment safe. So I thank the doctors because Ted is alive because of them. I thank the nursing staff. Everybody, it was a team effort. So my thank you to everybody at Loyola. Ted is here because of his care. I have no doubt about that.
To the doctors, to the nurses, and what I said to many of them in the hospital is I love you for who you are and for what you do. Everybody working in the COVID ward, the ER ward, were risking their health for mine. They were also risking their family's health. So that sacrifice, unbelievably tough for them. When you think about Loyola, and the teamwork is what really made it work. But if you think of the dedication all these professionals put in, and they all do it to save people's lives. And when you have an infectious disease, you really appreciate it.